Welcome back to Devine Inspired Care Channel. Glad you could join us again. Have you ever wondered how healthcare professionals assess a patient's health? This question brings us to the heart of today's topic, the head-to-toe assessment. This comprehensive evaluation is a cornerstone of patient care. It's like a detective's magnifying glass, helping healthcare providers to detect abnormalities, establish health baselines, and inform ongoing care plans. That's what a head-to-toe assessment is. It's a systematic process that begins at the head and travels all the way down to the toes. It's a journey through the body's various systems, ensuring nothing is overlooked or left unexamined. Picture a healthcare provider as a seasoned explorer, charting an expedition into the complex terrain of the human body. They set off at the head, the neurological control center, before venturing down to examine the eyes and mouth, the gateways to the body. The journey continues through the respiratory and cardiovascular systems, the body's engines, before reaching the abdomen and musculoskeletal system, the body's support structures. Throughout this expedition, the healthcare provider is not just looking, but also listening, touching, and asking questions. Each step of the way, they're gathering vital information about the patient's health. They're checking for signs of distress, disease, or dysfunction. They're establishing a baseline, a snapshot of the patient's current health status against which future changes can be compared. This thoroughness is what makes the head-to-toe assessment so invaluable. It doesn't just detect existing problems, but it can also identify potential issues before they become serious. It provides a comprehensive picture of a patient's health, allowing healthcare providers to tailor their care plans effectively. So, with this understanding of what a head-to-toe assessment is and why it's so important, we can appreciate the skill and knowledge that healthcare professionals bring to their work. It's not just about treating illness, but also about promoting wellness, preventing disease, and enhancing quality of life. Now let's dive into the specifics of this systematic process. The assessment begins with initial observations. These first impressions set the stage for the subsequent examination. The healthcare provider keenly observes the patient's overall appearance, demeanor, and any visible signs of discomfort. This initial observation phase is instrumental in establishing a rapport with the patient, helping them to feel comfortable and open about their health concerns. A vital part of these initial observations is asking the patient about their pain levels. This inquiry isn't a mere formality, rather, it's an essential tool in understanding the patient's current state of comfort or distress. Using a scale from 0 to 10, where 0 signifies no pain and 10 indicates the worst imaginable pain, the patient is encouraged to express their discomfort objectively. This feedback allows the healthcare provider to adjust the examination process, ensuring it's conducted within the patient's comfort zone. This initial question is crucial for tailoring the examination to the patient's comfort levels. Next, the examiner proceeds with neurological checks. This part of the examination is like a journey into the human nerve system, assessing how well our brain communicates with our body. To start with, the examiner conducts auditory tests. The patient may be asked to identify different sounds or repeat certain words. This ensures that the patient can hear properly and checks the functionality of the auditory nerves. Facial expressions are another key aspect of neurological checks. The patient is asked to perform simple actions like raising eyebrows, smiling, and frowning. These seemingly simple actions are actually complex orchestras of nerve signals, and observing them can provide valuable insights into nerve function. Muscle strength tests are also conducted. The patient may be asked to clench their jaw or push against the examiner's hand. These tests check the strength and responsiveness of the muscles, which are directly related to the functionality of the motor nerves. All these checks, from auditory tests to muscle strength tests, are like pieces of a puzzle, each contributing to a picture of the patient's neurological health. They allow the examiner to assess cranial nerve functionality and motor responses, which are crucial for everything we do, from speaking and eating to moving and expressing emotions. These tests are vital for assessing the patient's neurological health. They provide key information that can be used to detect neurological disorders early, plan appropriate treatments, and ultimately enhance the patient's quality of life. Following neurological checks, the focus shifts to the eyes and mouth. The eyes, they say, are windows to the soul, but in the world of healthcare, they're also windows to your neurological health. The patient is asked to perform peripheral vision tests and follow the examiner's finger with their eyes. This simple activity tests eye muscle control and coordination. Then a light is shined into the eyes to check pupil response. This is more than just a spotlight on the iris. It's a crucial indicator of neurological health. Next, we move on to the oral examination. This isn't your routine trip to the dentist, though oral hygiene is indeed part of the check. The examiner assesses the health of the gums and evaluates the throat for any abnormalities. A healthy mouth is a happy mouth, but more than that, the condition of your oral health can reveal signs of systemic health issues. For instance, inflamed gums could be a sign of diabetes, while ulcers or white patches may indicate a nutritional deficiency or infection. Healthcare providers can identify potential health issues that may otherwise go unnoticed. These examinations are essential in maintaining the patient's overall health. So next time you're asked to say "ah" or follow a light with your eyes, remember it's all part of the bigger picture of your healthcare journey. The next step in the assessment is the evaluation of the respiratory and cardiovascular systems. Let's start with the respiratory assessment. This involves listening to the patient's breathing with a stethoscope. It's not just about hearing the breath sounds, but also understanding their quality and rhythm. Whether the breath sounds are clear, whether there are any abnormal noises, and whether the breathing pattern is regular or irregular, all these factors provide valuable information about the patient's respiratory health. Patients are also asked to take deep breaths. This can reveal any discomfort or difficulty in breathing, which might be an early sign of respiratory conditions like asthma or COPD. Moving on to the cardiovascular assessment, here, the examiner listens to the patient's heart rate. They listen for the rhythm and rate of the heartbeat, whether it's regular or irregular, too fast or too slow. They also listen for any unusual heart sounds, such as murmurs, which might indicate problems with the heart valves. In addition to listening, the examiner may also measure the patient's blood pressure, which can provide information about the functioning of the cardiovascular system. High or low blood pressure can indicate conditions like hypertension or hypertension. Remember, early detection is the key to effective treatment and management of respiratory and cardiovascular conditions. These assessments play a crucial role in ensuring the patient's heart and lungs are functioning optimally. The assessment continues with checks on the abdomen and musculoskeletal system. The abdominal examination starts with the healthcare provider listening to gastrointestinal sounds, also known as bowel sounds, with a stethoscope. This is done to assess the functioning of the digestive system. These sounds may vary, but typically they are clicking, gurgling, or rumbling noises that occur in the abdomen. Absence, excess, or abnormal sounds might indicate issues such as obstruction or inflammation. After listening, the examiner palpates or gently presses various areas of the abdomen. This is to evaluate the size, location, and consistency of abdominal organs, and to detect any abnormal masses or tenderness. It also helps in identifying the presence of any distension or bloating. Pain or discomfort during palpation can suggest a variety of conditions, from infections and inflammations to ulcers and tumors. Now let's move on to the musculoskeletal examination. This part of the assessment evaluates the patient's range of motion, muscle strength, and joint health. The range of motion is tested by asking the patient to perform certain movements, such as raising their arms or bending their knees. Any limitations in these movements can indicate joint problems or muscle weakness. Muscle strength is tested next. The patient may be asked to push or pull against resistance, and the examiner observes if the patient can do so without difficulty. Decreased muscle strength could be a sign of conditions such as muscular dystrophy or nerve damage. The last part of the musculoskeletal examination involves assessing the joints. The examiner checks for swelling, redness, warmth, or tenderness in the joints, which could point to arthritis or other joint disorders. The patient's posture and gait are also observed to detect any abnormalities. The abdominal and musculoskeletal examinations together are a comprehensive way to evaluate the digestive and musculoskeletal systems. They can help detect a range of potential issues, from digestive disorders like irritable bowel syndrome or gastroenteritis, to musculoskeletal injuries or conditions like arthritis or sciatica. These examinations are key in identifying any issues related to digestion or movement. The examination concludes with checks on the extremities and sensory checks. As we near the end of our head-to-toe assessment, it's time to focus on extremity examination and sensory checks. These evaluations are a crucial part of the process, allowing healthcare providers to assess the peripheral nervous system's integrity. The extremity examination begins by evaluating the pulse points on the wrists and ankles. This simple task helps to determine the adequacy of blood flow to the extremities. Following this, the examiner checks the capillary refill by pressing on the patient's fingernails or toenails and observing how quickly the color returns. A normal capillary refill time is about 2 seconds, and any delay could indicate poor circulation. Next, the patient is asked to perform range of motion exercises for the legs. This includes bending the knees, rotating the ankles, and flexing and extending the toes. These movements provide insight into the health of the patient's joints and muscles. The sensory checks are then conducted. These involve distinguishing between sharp and dull sensations using a safety pin or similar object. The patient is asked to close their eyes and identify whether they feel a sharp or dull sensation at various points on their body. This test assesses the integrity of the peripheral nerves and their ability to transmit sensory information to the brain. These final checks ensure that no aspect of the patient's physical health is overlooked. They are an integral part of the comprehensive head-to-toe assessment, helping healthcare providers to detect potential issues early and contribute to better patient outcomes. A head-to-toe assessment is a vital component of patient care. It's the backbone of the healthcare system, the linchpin that holds our understanding of a patient's health together. It's a fine-toothed comb, meticulously scanning over every inch of a person's body, from the crown of their head to the soles of their feet. This thoroughness ensures that no stone is left unturned, no potential health issue overlooked. Imagine it as a detective, piecing together clues to form a holistic picture of a patient's health status. It's through this diligent process that we detect potential health issues early, before they snowball into something more severe. It's not just about identifying problems, though. It's about understanding the person as a whole, their strengths, their weaknesses, their unique physiological makeup. This level of understanding is what allows us to tailor care plans to the individual, to offer the most effective treatment possible. Through this meticulous process, practitioners can develop effective care plans and ultimately contribute to better patient outcomes. Having come this far in our comprehensive guide to head-to-toe assessments, we hope you found this information informative and helpful. But our journey doesn't end here. We'd love to hear your thoughts and experiences. Have you ever performed a head-to-toe assessment? If so, what was your experience like? Please share your thoughts in the comments section below. Your interaction is not only valuable to us, but it also helps our community of health practitioners and enthusiasts grow and learn from each other. Your insights could be the key to someone else's understanding, so don't hesitate to join the conversation. And if you found this video useful, please give it a thumbs up, share it with your friends, and subscribe to our channel. Your support allows us to continue producing high-quality, informative content tailored to your needs. Thank you for watching, and remember, your health is your wealth. Stay informed, stay healthy, and let's continue this journey towards better understanding of healthcare together. See you in the next video. Until next time, take care of yourself.